Well, I was very pleased to be part of the conference. My session majored on four key themes. I talked about whether or not the workforce that we're training now is the workforce that we want for the future, given that the customers, if you like, the patients that we're treating are so very different. The NHS used to treat people with their accidents and injuries and they go to hospital and die. Now we have people with long-term conditions and people whose whole experience as a patient crosses a lot of boundaries. So, are we teaching nurses in social working skills? No, I don't think so. Or what are we doing along the lines of, for example, Buurtzorg in Holland, where they have a whole different approach to community services. So that was my first key theme, training the workforce for the future for a very different workplace. My second theme was we are still really having too many what managers call interfaces, that's joins in the system. I'm pleased to see that some of the new Vanguard experiments are now vertically integrating care, so there's less of a difference between primary care and secondary care, and where we're working much closer with social services to help and facilitate discharge. But frankly, I'm looking forward to the day when we have population-based capitated budgets and the whole system works vertically as one. My next theme really was outcomes. I think the public are entitled to have much more information than we have about outcomes. I don't think we've got anything to be ashamed of. I think the public can understand that operating on an elderly, frail person is very different to operating on a young, fit person, so the outcomes will be different. But I do think we should start publishing clinicians' outcomes by name. And finally, I was giving some thought to what we do with data. The NHS has a fabulous data set going back to 1948. We're the only health service in the world with a complete data set that is that big. And we could use that with public health messages so much better. Simple things like who gets sick, what fixes them up, what did it cost, do we want to do it again? These are questions that we still can't answer all these years, but we have the answers locked up in our data set. So that was really my themes. My interest, of course, is the Academy of Fabulous Stuff. I set it up because I was so fed up with the CQC stomping around telling everybody how bad they were. We now have a place where you can go and have a look at best practice. We had 250,000 page views last week. It's hugely popular. And I hope you'll find some time to have a look at it. It's www.Academy of Fabulous NHS Stuff. And if you want to keep in touch with some of my ramblings and thoughts, you can read my 3 times a week e-letter, which is nhsmanagers.net, and you can find the link to that on the web.